guys, and welcome to the Mind Muse. So I changed the name of my channel because psychology is the niche that I'm going for. And so I hope you guys like the new name for the channel. And in today's video, accordingly, we're going to be talking about careers in psychology. I've already made a massive Q&A about clinical psychology in terms of the clinical psychology doctorate, and if that's something you're more interested in right now, then you can go check out that video. But today's video is for people who are looking for careers that are similar to clinical psychology but not clinical psychology itself. I hope that this video is useful for any psychology student out there. What happened was, when I was in my first year of university, and I go to the University of Nottingham, by the way, if you didn't know, I went to like an event, a talking event, don't know what to call it, not a meeting, you know, one of those events, and different people from different professions related to clinical psychology were there. They talked about their profession and how to get in and what it's briefly about, you know, and I took some notes and I decided this is a great thing to make available on YouTube again, because as I've said in previous videos, the amount of information about psychology online is not good in my opinion, so we need to boost it up. So the first thing I'd like to talk about is, why are alternatives to clinical psychology even important in the first place if you know that clinical psychology is the only thing you want to do? Now, I'm somebody who really likes clinical psychology, but I'm still considering these alternatives because it's a very competitive course to get on if you want to practice as a clinician, you know, for clinical psychology. Around 3,700 people will apply per year and only around 580 will get accepted. That's a 15 to 16% acceptance rate. Very, very low. And it's, for some people, after trying several times to get in every year, you might just be like, you know what, maybe something else is meant for me instead. So we're going to get into those alternatives. But a disclaimer, I don't want people to approach these alternatives with the idea that it's an easier alternative, you know, especially I'm about to talk about PhDs as well, you know, like they're not necessarily easier alternatives, they're just other types of options that may work better for you. So the first one is IAPTs Therapist. Excuse me, I'm looking at my notes that I took ages ago. I mean, I've delayed this video since April. It's really bad. But yeah, I'm looking at these notes. IAPTs Therapist. This stands for Improving Access to Psychological Therapies, and they're also known as Psychological Wellbeing Practitioners. What they do is identify common mental health problems, and they give access to assessment and treatments. So it's quite similar to what clinical psychologists do already. However, the entry for it is a different type of course, a BPS accredited psychological wellbeing program, and what it does is it considers a low intensity approach to psychological treatment. So if that's something that you feel could actually be of interest to you, definitely check it out. This video isn't meant to give you all the research you ever would need about every alternative to clinical psychology. It's really just to let you know what the names are and briefly what it's about, so you can go and start doing that research for yourself. Maybe when I acquire more information myself in the future, I'll be able to talk more about each of these professions, but for now I don't have the knowledge to do that. And the second one is mental health social worker, and I actually feel quite good about this one because my mum is a social worker and she has been for I think almost 2 decades now. And actually what's going on with social work is there is not enough social workers choosing to specialize in mental health. So what happens is, when you apply for the 2 years postgraduate course to do mental health social work, after you do after you qualify as a social worker first, because that's a prerequisite, they will fast track you because they just don't have enough social workers that specialize in mental health. And I don't really know why right now. People who advocate for mental health and the whole industry of that part of health still needs, you know, more voices for it. So it's kind of like a growing field for different careers. It's not just in psychology. So what happens with the mental health social worker? What do? They work with a multidisciplinary team, just like clinical psychologists. So they might work with psychiatric nurses, other types of social workers, and they will coordinate the care for people that has already been agreed before. So you're not really planning what someone's going to do, or, you know, what type of things are going to happen for them, but you're just executing it, helping them execute it. The next one is counselling psychology. Now, for this one, you do have to be registered with the HCPC, and you need a doctorate. So it's a different type of doctorate to the clinical psychology doctorate. You come out of it and you can kind of be like a clinician. You are practicing, you know, you are interacting with patients, except of course this doctorate is called the Counselling Psychology Doctorate. And if you want a bit of inspiration, or you want to know what someone who's very excellent in this subspecialty of psychology is up to, I definitely recommend checking out the Instagram page of Dr. Becky Spellman. Here in the UK, she is one of the best counselling psychologists, and she's kind of a figure for it because she is on social media a lot, and she makes public appearances and TV appearances every now and then. So you get to work in industry, private sectors, GPs and psychiatric hospitals, etc., as a counselling psychologist. This type of doctorate is not as competitive as a clinical psychology one. Now, the next one is occupational therapy. You work with any disabilities that are caused by accidents or aging, and you address a range of problems. You might work in hospitals, community settings. You might even visit clients in their home as an occupational therapist. This requires a 2-year postgraduate course as well. Mind you, I'm saying postgraduate, not like 2 years undergraduate course. So after you do 3 years of a degree, you would need 2 years postgraduate course related to, or in occupational therapy for this profession. So yeah, it's still a number of years that is required before you can get into this type of profession. Just as I said in the beginning, it's not something that you use as an easy alternative to anything. I don't think anybody should actually have that approach to any career, because they're all going to offer unique and very valuable types of work for different patients, you know, things like that. The last one is the good old PhD. Now, people already know what a PhD is. It's when you get research in anything. You start to research any topic. You can get a PhD in anything. So the ones I'm obviously talking about is getting a PhD in clinical psychology. That is the closest type of PhD to just doing the clinical psychology doctorate. Now, for the person who came to talk about this type of PhD, said that it relates to design interventions, thinking creatively about interventions, so it relates to designing interventions compared to the clinical psychology doctorate, where it's more about executing interventions. So if you were considering, you know what, clinical psychology is definitely the subspecialty of psychology for me, but I don't really know if I want to research or practice. Just think about your attitude towards interventions. What do you want to do with it? Do you want to design it? Do you want to think critically and creatively about it? Or do you want to kind of deliver it, execute it? And also, the person who was within this field of PhD clinical psychology mentioned the fact that it's actually quite a flexible postgraduate course. Sometimes you can interact with your specialism, for example autism, and other times you don't necessarily have to. So if that type of flexibility appeals to you, then maybe you might want to consider clinical psychology PhD. Anyway, that's all for today's video. Of course, there are tons and tons of alternatives to everything, so this video is not encompassing of everything, but I do hope that it's helped someone out there and it has introduced you to some types of alternatives that you previously probably never even knew about related to clinical psychology. If you liked the video, like and subscribe, and I'll see you guys in my next video. Bye!